Today, I'm going to talk about how functional medicine can help with cognitive impairment. My name is Andrea Okos. I'm a registered nutritional therapist and functional medicine practitioner, a board-certified health and wellness coach, and a Bredesen Protocol certified practitioner as well. First, I'm going to talk about the comparison between conventional and functional medicine. So conventional medicine, basically, when we go to our GP or our gastroenterologist, dermatologist, those are all conventional medicine doctors. What they do, they specialize on a body part. So it's all separated. If you have a skin problem or a digestive system problem, we go to different specialists. Our GP, unfortunately, sometimes just spends 10 minutes with us. We can discuss only one issue. So, for example, we can say, oh, I'm constipated, I need help with that. But I can't say I also have a rash. Let's look into that as well. We almost like we need to separate those two problems. What their goal is to diagnose, and based on the diagnosis, to have a treatment with a pharmaceutical. This works well when there is an emergency situation, for example, heart attack, we broke our bones, and drugs are very important in certain cases. Like, for example, if somebody has high blood pressure, they probably need to be on a drug unless they do other lifestyle changes, then they might be able to get off the drug with the help of the doctor. Unfortunately, this approach doesn't help so much with chronic diseases like diabetes or other systemic inflammation, because we don't go into the root cause why that's happening. And there is the one type of treatment approach. Everybody is going to get, for example, cortisol cream on their eczema. There's no differentiation between people. Comparison with that, we're going to talk about functional medicine, but it's not to replace conventional medicine. It's more like adding into it. It's a partnership between conventional and functional medicine. As a nutritional therapist, when I see somebody for a functional medicine appointment, basically I need them to fill out some forms, because what I'm going to look at is all this interconnectedness. If they have some gut issues, they have the skin problem, maybe their thyroid is a little bit sluggish, what exactly is going on? And I connect all these, and based on that, we can do a more personalized approach. Usually I have an appointment of 1 and 1.5 hours long, and we address all the body parts. We look at the root causes and the interconnectedness and what we can do to go to the root cause, and that ultimately is going to help with the symptoms. It's more individualized. It's very science-based. We don't do anything that is not research. There is not research behind it. And based on all the information, we personalize it. It might be very different from one person to another, depending on the root causes that we found. And we need to understand the genetics, but the genetics, it's kind of predisposes us to illnesses, but it's called epigenetics when all the other influencing factors are going to come into place, and that genetic predisposition might not manifest. We're going to look at imbalances, deficiencies, and what diet and lifestyle we can therapeutically prescribe for the person to help with the root causes. So who can do functional medicine? When we think about a nutritional therapist is trained to apply evidence-based diet and lifestyle changes therapeutically to address imbalances, deficiencies, to reinstate the innate balance in our bodies. Everybody knows what a doctor does, a conventional medicine doctor, and both medical doctor or nutritional therapist, they can decide to train in functional medicine. They're going to get the same training to apply functional medicine in their practice, which is basically getting to the root cause of the symptoms and using personalized approach. The difference is that a functional medicine doctor, because they are doctor, they can call themselves functional medicine doctor, and nutritionists might call themselves functional medicine practitioner. And obviously, a doctor can also prescribe medications, and nutritionist is more into herbal remedies, supplements, and so forth. And in addition, there is the coach. Many times people know what to do, but they still need hand-holding through the process because behavior changes are very hard to make, or they are too confused with the whole process. For example, a functional medicine doctor might have just 45 minutes to tell them about a program they prescribe, but the person still needs a little bit more coaching through maybe different multiple weeks, half an hour coaching per week to get them to more knowledgeable about the program. So let's talk now about why we are here today, dementia, Alzheimer's. There was this research that American insurance companies have done where they looked into between 2013 and between 2017 how the cognitive decline has developed in their basic people insured with them. And the sad news is that we can see that between the age of 30 and 44, it went up 373%, between age of 45 to 54, 311%, and between 55 and 64, 143%. I remember I was thinking about somebody with Alzheimer's more like being in their 80s or 90s, not necessarily in the age group that we still think as quite young, 55 to 64, or even an age group over 30. People experience more and more cognitive decline. So what I would like to do is to share a 2-minute video here.
Of the over 328 million people in the United States, 45 million are expected to develop Alzheimer's disease during their lifetime. Healthcare is currently undergoing a transformation from 20th century medicine to 21st century medicine. 20th century medicine relies on small data sets for traditional diagnoses, which do not answer the question of why the illness is present. This one-size-fits-all approach has been thus far unsuccessful in treating chronic illnesses such as Alzheimer's disease. This brings us to the transition to 21st century medicine, which uses large data sets for diagnoses and helps identify changes in the network of the human body that characterize chronic illness. We can reveal the why for each individual and address the cause of each condition in a comprehensive, personalized, and pragmatic way. This transition combines the best of Western medicine and Eastern medicine practices. Using the 21st century approach, we have found that treating Alzheimer's is analogous to repairing a roof with 36 holes. Treating the disease requires addressing many aspects of the body at one time, as you would when repairing holes in a roof. The more holes you cover, the more success you will have at fixing the problem. Current pharmacological approach is focused on developing a drug to combat Alzheimer's. If we were to create a single drug specific to Alzheimer's, it would have to perform so many different functions that it would be unlike any drug ever developed. While the single pill approach may not be a viable option, by knowing the characteristics of the disease, we can address the underlying problem and patch 36 factors, or holes as we referred to them in our earlier analogy. This approach is the cornerstone of the Bredesen Protocol.
So what's the Bredesen Protocol, and who is Dr. Bredesen? So Dr. Bredesen is an internationally recognized expert in the mechanism of neurodegenerative diseases. He has 30 years in research in this area, cognitive decline, Alzheimer's, dementia.
The idea that Alzheimer's disease can be prevented and even reversed is transforming the medical world. Today, we get to speak with one of the key people responsible for this revolution. An internationally recognized expert in the mechanisms of neurodegenerative diseases, Dr. Dale Bredesen's research explores previously uncharted territory in explaining the physical mechanism behind the erosion of memory seen in Alzheimer's disease, and has opened the door to new approaches in treatment. This work has led to the identification of several new therapeutic processes that are showing remarkable early results. Dr. Bredesen is a prodigious innovator in medicine with over 30 patents to his name. Notably, he put much of his findings and research into the 2017 New York Times bestseller book, The End of Alzheimer's. His most recent book, The First Survivors of Alzheimer's, also presents the stories of 7 individuals who reversed their cognitive decline using his RECODE protocol. Dr. Bredesen graduated from Caltech and earned his MD from Duke University and served as chief resident in neurology at the University of California, San Francisco, before joining Nobel laureate Stanley Prisner's laboratory at UCSF as an NIH postdoctoral fellow. He has held faculty positions at UCSF, UCLA, and the University of California, San Diego. Dr. Bredesen also directed the program on aging at the Burnham Institute before joining the Buck Institute in 1998 as founding president and CEO.
So Dr. Dale Bredesen, after doing all this research, he came up with the reason why, what is the reason to develop cognitive decline. He has multiple books, and the one on the picture is the last one, The First Survivors of Alzheimer's, which talks about those first people who were involved in the trial for the Alzheimer's or the Bredesen Protocol. And in the book, they talk about their experience. I would like to share just a few sentences from 2 of the people on this book about how they experienced the Bredesen Protocol.
A number of Alzheimer's patients are describing how they regained their memory after starting the Bredesen Protocol. It's not a drug. Instead, it's a number of lifestyle changes, including diet, exercise, and much more, each designed to address the approximately 40 different causes of Alzheimer's.
As you can imagine, I was terrified.
9 years ago, after Julie Gregory got lost on a very familiar road, she soon learned she had Alzheimer's.
I had lived in this town in the foothills of Georgia for 20 years, and I would run into people in shops who knew me very well, and Lori, I had no idea who they were. My personality began to change.
Julie also learned no cure or viable treatment exists for the disease.
I even contemplated ending my own life. And I think prayer brought me to the point where I realized what I was learning from mainstream medicine just wasn't true. I began to believe in this voice that was telling me there was something I could do.
She tried the Bredesen Protocol, got back to normal, and has stayed there ever since.
What he does is identify and address every person's contributor to their symptoms. It's just plain old common sense, and my experience shows me that it works.
Sally Weinrich tells a similar story.
I forgot to pick up my grandchildren twice, one morning in the morning for school, within a month period of time.
5 years ago, Sally also considered suicide after experiencing the unmistakable signs of Alzheimer's.
I had 2 relatives die from it, really 3 relatives die from it, on both sides of my family. I knew I was at risk for it. I had a dread for it.
She believes God led her to Dr. Dale Bredesen.
I had all of the Dr. Bredesen's causes of Alzheimer's, and I think in my case, my Alzheimer's would have progressed very rapidly.
Instead, the opposite happened.
The best thing about my Alzheimer's today is I have answers for it and I have reversed it. It's wonderful. I love life. I enjoy life.
Sally, Julie, and 5 others describe their amazing reversals in the first survivors of Alzheimer's, how patients recovered life and hope in their own words.
So in one of the videos, you heard about the 36 hole roof. So basically what he says that there are many different factors that contribute to the cognitive decline of the brain function. And based on his research, he came up with these 6 subtypes, basically the different contributing factors to this decline. So you can see here, one might be inflammatory type. That means that a lot of the blood markers that look into inflammation have very high values. So there is some inflammation going on in the body that influences later on, if we don't do anything about it, the brain development or stops the cognitive, so it starts the cognitive decline. Another one is glycotoxic subtype. So that is basically prediabetes, diabetes. Atrophic, it's hormone imbalance related. Toxicity is a big problem. Toxicity can come from chemicals, from heavy metals, actually from mold as well. So until we trade a toxic matter and the person doesn't get out of the toxic environment and their body is not helped to detoxify properly, then we can't help with the cognition. Then the last 2, vascular and traumatic. So after he came up with these subtypes, he developed the cognoscopy. So it's not colonoscopy that we need to do from the age of 50 or 55. This is called cognoscopy. And it's a series of blood tests plus a genetic test, potentially also brain scanning, an MRI scan. And based on the results of all these tests, there is, if you see here on the side, everybody is run a report, a very personalized report based on their test results. Also, the person would do a cognitive assessment online or a MOCA test with a practitioner. And based all that gathered information, a report is generated telling what are the highest risk factors and listing a very personalized therapeutic protocol that the person can follow to reverse or prevent this cognitive decline. So Dr. Bredesen says that everybody should get a cognoscopy from the age of 45, unless they have medical history, their parents, grandparents had developed Alzheimer's, or they passed away from Alzheimer's. In that case, it's best to do from the age of 30. And why is that? Because through his research, the best results from the trial, that was for those people who have not developed it yet, who might have been on the early phases of Alzheimer's or medium or subjective cognitive decline. So what it means that, for example, on the MOCA score, 30 is the maximum. But if you have 25, 26, then you're just starting a decline. If somebody has been diagnosed with Alzheimer's, but very, very early stages, might still be in the same category. So the most success on Dr. Bredesen trial had those people who started, had not developed yet or haven't been advanced in, it was just the early phases of Alzheimer, or they were doing it for prevention. So from that, the message is that we need to do the cognoscopy as soon as possible so we can see what's going on, whether we start to develop any of these contributing factors, where the risk is, where we need to start to do some diet lifestyle changes. So we're going to talk about what are these lifestyle changes, or what are it called, the Bredesen 7, in our next session.